My name is Heidi Spillane. I'm a general practitioner and also training to become a sexual health physician. Homa Bay is on the shores of Lake Victoria, and a lot of the people earn their income from the fishing industry. So there's lots of fishermen who will by boat travel from place to place. Often the women that will buy the fish from them in order to sell on will often offer sexual favours for fishermen who sell their fish to them. So HIV is very easily transmitted in a context like this. Also there's a culture of polygamy there, where one man may have more than one wife. So again, this facilitates HIV transmission. We also know that the Luo culture are less likely to be circumcised, which also contributes to prevalence of HIV in that context. So in my work in Kenya, I worked in the tuberculosis clinic, and their patients would present with symptoms of tuberculosis. So they may be coughing or have a high fever or present with very severe weight loss. We would make a diagnosis of tuberculosis in the clinic itself, and we would also offer them a HIV test. So tuberculosis has been around for a lot longer than HIV. But with the rise of the HIV epidemic, we have seen also a rise in tuberculosis. And this is because the HIV virus depletes the immune system, and people who are infected with TB are much more likely to present with tuberculosis disease because of their immune suppressed state. So the impact of such a high HIV prevalence rate in an area like Homa Bay meant that often, teachers may end up dying from HIV. People in the hospitals, the nurses, healthcare staff, doctors may have HIV. I know certainly that some of our staff members had HIV. So it does have an impact on much more than just the individual, but also on the community, on the economy there. It had quite a profound effect on all of those areas of life in Homa Bay.